The broadcast is now starting. All attendees are in listen-only mode.
Hello, welcome to the Ohio Commission on Minority Health's Systematic Lupus Erythematosus FY 2020 Application Technical Assistance session. Today we are going to review the application process, and if you have the SLE RFP in front of you, it's a great way to follow the application process. Our slides will closely follow the format of the application. So I'm going to review with you today some background about the commission, submission information, funding eligibility, critical elements of the grant, and we're also going to take a look at our new grants application system. If you have not done so yet, I suggest you look at our technical assistance session for our new grants management system, which is located on the Commission's website at www.mih.ohio.gov. And the Commission's website that I just said, it's a great resource for new applicants and for old applicants as well. But all of the links that you need are on that website as well. So this will also be posted once it is completed. So a little background about the Commission. In February 1986, the Governor's Task Force on Black and Minority Health was appointed to determine the reasons why a disparity existed between the health status of minority and non-minority Ohioans, and to recommend methods to remediate the disparity. In July 1987, the Commission on Minority Health was created by amended Substitute House Bill 171 for the purpose of providing health promotion and prevention of disease among minority Ohioans who are economically disadvantaged. In state fiscal year 1994, the Ohio General Assembly appropriated funds to the Ohio Commission on Minority Health to provide funding for programs designed to serve Ohioans affected by systematic lupus erythematosus. The Lupus Grant Program targets all Ohioans in need of services regardless of race, ethnicity, or income. It is a goal of this grant program to serve the diverse needs of each city receiving funding. So a little bit background about lupus. So it is potentially serious, complicated, generalized inflammatory connective tissue disease that can affect many different organs of the body in varying combinations. The vast majority of persons with lupus, about 90%, are young women. The disease usually begins in adolescence or adult life, and it may start acutely. The course of the disease is usually chronic and irregular, with periods of activity alternating with periods of remission. The manifestations of lupus can be quite different. They include joint inflammation, fever, a red skin rash, pleurisy, anemia, kidney disease, brain involvement, pneumonia, heart disease, and eye disease. Individuals with lupus have certain immune system abnormalities. Instead of the immune system serving its normal protective function, it forms antibodies that attack healthy tissues and organs. It is clear that lupus is much more common than it was thought to be 25 years ago. It is one of the most frequent serious disorders of young women. An overall prevalence rate for lupus has been reported that 1 in 185 people in the United States and 1 in 62 minority women. In general, African Americans have higher rates of incidence, prevalence, and mortality than whites. The age of onset lupus is approximately 6 years earlier for blacks than for whites, and the peak age of mortality for lupus is also earlier in blacks than whites. In addition, African Americans, Puerto Ricans, Chinese, Japanese, Filipinos, and ethnic Hawaiian women have exhibited increases of lupus. So for this year, the Ohio Commission on Minority Health announces the availability of funds for fiscal year 2020 to support lupus programming, focusing on patient and public education. Grant funds will not exceed $16,000 per applicant agency per year for a maximum of 6 funded grants. Funding priority will be given to service areas demonstrating greatest need for lupus programming. Only one application will be accepted per agency. July 1st, 2019 through June 30th, 2020 constitutes the first funding period covered by this RFP. Notification of funding will be in early June 2019. As well as all grants, funding is contingent on the approval of the state budget and the availability of funds. Grants will be effective July 2019 with an immediate startup required. This must be reflected in the recruiting, hiring of staff in the first month in the immediate implementation of program activities no later than the second month of the first quarter of funding. So again, July 2019 is when grants will be awarded with an immediate startup required. This again must be reflected in the recruiting and hiring of staff in the first month and the immediate implementation of program activities no later than the second month of the first quarter. This is also a performance-based grant. The 2021 year of funding is non-competitive, but is contingent on a change achieving a proportionate level of projected outcomes during the first year of funding and the availability of funds. Again, this is a performance-based grant, and so for your second year of funding, it's non-competitive, but also based on your performance from the previous year. The Commission reserves the right to terminate the grant prior to the second funding cycle if the project does not perform in accordance with stated measurable outcomes. For the second year, program activities must continue without gaps in service by providing program activities beginning in July 2020 and June 2021 if funded. The Commission will not consider funding for proposals from the following: if you're an individual applying for funds, national organizations, such as local chapters or affiliates of national organizations, may be eligible if they meet the definition of a community-based health group. Organizations applying for the sole purpose of acquiring funds to supplement existing programs without any plan for enlarging their scope of work. Organizations in the process of creating or starting a community-based health group for the sole purpose of applying for grants from the Commission. All right, so some technicalities for this lupus grant. So all applications must be submitted by June 3rd, 2019. And again, June 3rd, 2019 is the due date for all lupus grants. The MHGM system will be closed for submission of this application type. Any application or supporting documentation submitted after the June 3rd due date and time will be returned without review. So again, like I mentioned in the beginning, this is a new process. If you're new to the Commission, that's great. We're glad that you're on here today, but we do have a new application process. All applications will be submitted in our MHGM system, which the links can be found on our website at www.mih.ohio.gov. We will no longer be accepting hand-delivered, faxed, mailed, or emailed applications. Applicants must allot sufficient time to submit the application in the new MHGM system. Given that this is a new system, we strongly advise that you allow enough time for any questions you may have to be both submitted and responded to. The submission of a technical assistance request regarding the application and guidelines in the MHGM system during the application period will not change the application due date. So for funding eligibility, the Commission will grant awards up to $16,000 per agency to support lupus health promotion activities that focus on patient and public education. Funds must be budgeted on an annual basis and not exceed the grant award. Again, this is a performance-based grant. Preference will be given to grants that focus on expenses on costs related to program services. Equipment purchases will be disallowed, and agency and personnel expenses should be kept to a minimum. Successful applicants will be required to participate in Commission-supported trainings and scheduled lupus calls with dates and times located in the AOT. All grant recipients must have a fully executed acknowledgement of terms to include original signatures submitted on the website, as well as compliance with all identified program and all identified fiscal special conditions within 60 days of the grant notice. Failure to meet this requirement will result in forfeiture of the grant. So here are some critical elements of the grant, and again, if you're following with the RFP open, this should really follow the RFP format. Projects are required to provide 12 months of active program and face-to-face services through optimal health support groups. The minimum number of group participants is 10 people with lupus. Projects are required to conduct Lupus Optimal Health Group services starting in July 1 and through July 30th, 2020. Marketing and outreach activities are not considered program services. So again, that goes back to talking about you really have to start up with your conducting your groups within the first couple months of being awarded funding. Grantees will be required to participate in kickoff events for Minority Health Month in March 2020. The grant application should address attendance at these events under the travel section of the budget. Commission funds cannot be used to develop educational materials. Patient education activities must provide a strong educational component. Grant funds can be used to pay for expert presenters and results in the transference of skills. Commission funds can be used to support awareness projects for the community at large. This public awareness campaign may be a useful way to help identify cases of lupus for people who have the disease and do not know it. So critical elements for the patient education section: conduct at least one monthly face-to-face optimal health support group that is facilitated by a trained facilitator and includes balanced presentations. Provide a referral list of area facilities and physicians that provide medical treatment for lupus and related medical conditions. Conduct a training opportunity that enhances the combination of patient, caregiver, and professional education. Provide outreach to minority women, and the minimum number of group participants is 10 people total. You must include caregivers and children of persons living with lupus. Conduct presentations that enhance lupus education. Participate in local events. Participate in Lupus Awareness Month. And enhance public education via media outlets. Each funded agency is required to administer and review the symptoms checklist. This is a mandatory requirement of funded agencies. Every person who receives a symptoms checklist and has 4 or more symptoms, their contact information should be collected so the grantee can follow up with those individuals. Please note, requesting contact information for follow-up to see if the individuals were able to follow up with a healthcare provider is not a violation of HIPAA. Grantees are required to maintain participant files. Participant files must contain the following: individual file for all program participants. Program participants' files should not include their first and last names or home address. So the participant identification system can be as follows: first name, last initial, or vice versa, number, a group name, a subgroup, or by alphabetic. All progress notes must be written or typed in blue ink and updated after each program activity, signed and dated by the project director. All funded grantees must participate in the OCMH kickoff activities for 2020 and Minority Health Month 2021 if funded for year 2. SLE grantees are eligible to apply for separate 2020 Minority Health Grant funding. However, failure to obtain separate funding will not remove the requirement to attend the events. So continuing on to more critical elements. An acknowledgement of terms will be provided electronically within the grants management system. All grant recipients must upload the signed AOT into the MHGM system. Instructions on how to upload and submit the AOT and responses to special conditions and other required documents can be found in the MHGM Applicant User Guide, which will be located on the Commission's website. All grant recipients must have a fully executed AOT within 60 days of grant notice. Failure to meet this requirement will result in forfeiture of the grants. All grantees must participate in monthly SLE calls on a standing date. That will be shared in your AOT as well. And all funded grantees must complete and submit quarterly program fiscal reports to the MHGM system. This will provide an update to the Commission on program progress and outcomes to date. These reports will provide clarification on both qualitative and quantitative outcomes. Again, this is a performance-based grant. Grantees who are not up to performance level by the second quarter during the first year of funding will be required to attend a performance funding status meeting. This will also apply to subsequent quarters throughout the funding cycle. The Commission reserves the right to terminate the grant prior to the second funding cycle if the project does not perform in accordance with stated measurable outcomes. All right, so if you have not reviewed the systems training technical assistance session, I highly recommend that you do that. It shows you how to log in to the system, how to create a username, how to create your organization, and how to get into our grants management system. And this training was held on April 24th. Applicants can access the pre-recorded sessions that provide an overview of how to access, register, and apply in the MHGM system on the Commission website at www.mih.ohio.gov. So responses to this RFP application should be prepared following the guidance in the RFP. Proposals that do not provide all of the requested information or do not meet all the requirements will be determined incomplete and disqualified. The applicant user guide can be accessed on the Commission website, again at www.mih.ohio.gov. So these are the components of the application: face sheet, organization information, project abstract, proposal narrative, staff description, method of implementation, project action plan, line item budget, project documentation, signatures, and grant submission. And now we are going to go into the system and look at a example of what a submitted grant looks like. All right, so this is what the new system looks like. I'm going to search for an already submitted grant that's not necessarily an SLE grant, but I'll show you the components of what is expected. All right, we'll give it a moment here to load. All right. I'm going to search a grant application. Let's do 2018. All right, now this is an application that was made up by our staff. So you can see that the grant type is a demonstration grant, but for the SLE grant, demonstration grant, any other grant, this will all look the same. So you'll see the application process follows the RFP process. And a lot of this information, if you are a previous grantee, you'll see that the questions really haven't changed. It's just the format has changed. So again, this is your face sheet. You'll, once you have registered yourself and your organization, this should auto-populate but it'll ask you to pick your fiscal year, your grant type, your project area, and your amount requested, and you'll see that everything that is asterisk red, that's information that you'll have to put in. And once that information is in, you'll go forward and you'll click next, and you'll get to your organization information, which should auto-populate from when you registered your organization in the beginning. You'll have to fill out your project abstract, your proposal narrative, which again, this information shouldn't be new to everyone who has submitted a grant before. We're asking about health areas, demographics, genders, age groups, mission, mandate, etc. Then once that is done, you'll do your staff descriptions. So you'll list your staff of the agency or your board or advisory committee. And then you'll answer method of implementation questions, and then your project action plan. And for previous grantees, this is probably the section that's going to look the most different. You will have to click through a series of sections to build your project action plan. The project action plan will not be, you will have goals and objectives that are in there already, and you'll have to click the ones that are appropriate to your program. You'll have to submit a line item budget, so please make sure that's prepared ahead of time before you go ahead and enter it into the system. And then there's a project documentation section, which has all the project documentation that was required previously, your 501c3, your Civil Rights Act, letters of support, etc. And then there will be a electronic signatures page, which your executive director, project director, and fiscal officer will have to submit. And this is that replaces our original signatures. And then you will submit your grant. And again, a much more in-depth look at the system is in the systems training. So I definitely suggest that you take some time to review the systems training technical assistance session as well if you've not already done so. So some system quick tips. This again is in the other TA session. Please gather all materials needed to complete and submit the application. Please be aware that your application session will expire after 30 minutes. So when you're in the live system, there will be a countdown clock at the top of the page, and under 5 minutes, a pop-up will be displayed. The pop-up will ask you if you want to continue the session. If you are not at your desk when the pop-up comes up, the system will log out. When logged back in, an indicator triangle will show up at the top of the screen and ask if you want to retrieve your unsaved data. If you're working in the system and you advance and click the next button, this will save your work. Fields with red asterisks are required to be answered before advancing onto the next section of the application. Character counts for each section are as follows. Please remember this is a character count and not a word count. So you have some here, but also in the application itself when you're filling it out, each box will let you know how many characters you're allowed. If entering responses to the questions in a separate Word document prior to working within the system, Microsoft Office does have the ability to do character counts. Again, just some requirements: an uploading of assigned acknowledgement of terms in response to the program fiscal special conditions. You'll have quarterly reports, participation in our Minority Health Month Expo kickoff, submission of an FY20 year-end summary data, which was formerly your annual program report, will be part of the fourth quarter report with just additional questions. And then so we formerly had a biennial program report that will still occur if you are funded for the second fiscal year. And then again, all grant recipients must have a fully executed acknowledgement of terms within 60 days. The final selection process will involve a ranking system based on the weighted score, reflecting compliance with the proposal criteria. Grants will be awarded to the highest ranking applicants who represent a combination of geographic, demographic, service delivery, program activity mix, targeted to racial and ethnic groups, and disease conditions identified by the Commission. You will also be reviewed about your service area, innovation and impact, program design, evaluation, and budget appropriateness. And again, as a reminder, this Lupus grant application must be submitted in the system by June 3rd, 2019. And now we will take questions. Please make sure you type your questions in the question box below. Thank you.